my duodenum, which is the next part of my colon, right? Pain 2 to 4 hours after eating. Risk factors: H. pylori, certain meds, alcohol, smoking, and gastritis. All right, treatment: antibiotics. Kill the H. pylori. Worst case complication: you got a hole being eroded into your stomach wall. Worst case scenario: hemorrhage. 10-cent word for bleeding. Watch for pain, nausea, vomiting. What's hemoptysis? Hematasis?
It's drawing up blood.
Puking up blood.
Yeah.
Puking up blood. That means I'm bleeding in my stomach. That would get my attention.
What is it called?
Well, this one's got it misspelled. Hematasis. Emesis. It's bloody emesis. Heme. I always said hemoptysis. The other word for it. Bloody emesis.
Throwing up blood.
Walking up blood, yep. We assess the vitals, we treat with fluids, we may end up giving whole blood, keep them in NPO, place an NG tube. Why do we put NG tubes in people? I want to empty that gastric, right? If they have a small bowel obstruction, they've had a surgery and we need to decompress the gut, maybe they've ingested a poison, you need to let the gut rest. All right? The gut is meant to go this way. If I got a blockage down here, if it can't go this way, guess what it's going to do? Come right back up. And again, antibiotics, antacid, PPIs. Hit the lights for a second. Isn't that lovely? Alright, see how the tube came past the esophageal sphincter and past the stomach and into my duodenum? That's the ulcer. That's what it looks like when the doctor's doing this. This one is in the stomach. That's the ulcer. Isn't that lovely? That's nothing I want. Okay, grab the light.
Are they able to dissect that at all if they need to?
You mean take the whole thing out? I'd rather give you medicines and let your body heal it from the inside out.
Okay.
Get rid of the triggers.
Is it like worst case where like they like the medication doesn't work and they have to dissect it? Or is that
They'll go in and open it. They'll open it up and yank it out. Good questions. All right, appendicitis. Anybody ever have appendicitis? What is my appendix? And why do I care? What is he?
This tiny little thing.
It's this little la-la about this big. It's about the size of your little finger. Where's he hanging off of?
Your cecum.
Your cecum. We're not quite sure what his job was ever supposed to do. Some people theorize he was part of our lymph system, that he got rid of poisons. Is he hollow? Yes. He's a hollow piece of your gut. Sometimes things get stuck in there. Either a piece of stool or maybe a gallstone. Yeah. Or, just God tells a sunflower seed to get down in there and you can't get it out. When something gets stuck in this little guy, he gets all kinds of angry. All right? He gets hot, he gets swollen, he hurts. And so we need to assess what's going on and figure out, does this need to come out? Okay? So we got a nauseated and vomiting 20-year-old. Comes into your ER brought by his mom. He tells you the pain is 9 out of 10. That's pretty significant for a 20-year-old. He assumes a sideline position on the stretcher with his knees drawn up to his chest. He's crying like he's 5. What do we want to do? Scan? How about we get a set of vitals first?
Scan see the see where his weight count is.
Yep. He's got a temp of 100.3 Fahrenheit, his heart rate's 110, his respiratories are 24, his blood pressure is 110/70. And he exhibits guarding and rebound tenderness at McBurney's point. What's the matter with his vitals?
What's
You guys see this too? You see the blood pressure starting to trend down?
Yeah.
You see his heart rate starting to come up? When you see that seesaw, that is the body trying to compensate. That is the natural compensatory mechanism. If he's gonna go septic on you, everything vasodilates, so my blood goes from my nose to my toes, and my heart gets all excited and says, well, dang, we gotta move it real fast, because we ain't got enough in the pipes. So it starts. That's why you get tachycardia with hypotension. Okay? He's not there yet, but he's working on it. Respir's 24. What's McBurney's point?
By your belly button.
You're close. You're close. It's by your belly button. My other favorite way to figure out if somebody's got appendicitis was I'd walk up and slap them on the bottom of their foot. Bottom of the right foot. Causes enough of a joint that I'll see him holler. Another old school way of doing it is tell them to jump off the couch. They jump off the couch when they do that jarring motion. If it hurts enough they pass out, guess what? You got appendicitis. Is that fair? Do the McBurney's check, okay? Rebound tenderness means you're gonna push at that spot, and when you release, they squeal. That's rebound tenderness. Hang on. All right, there's your markers. So you find the umbilicus. Yes, we find the umbilicus, we find the hip bone. All right, McBurney spot is right about where my belt is. Okay? And then you take the pads of your fingers, don't do it ladies if you got, claws. But use the pads of your fingers, you push at that spot, and when you let go, they squeal, you got a positive. I would learn this. So, history of present illness. He tells you the pain started about 4 hours ago. It's become more intense, and that's a typo. It's his right lower quadrant. He has no appetite. He puked once at home. No significant history. He denies ETOH. What's ETOH stand for? Booze, alcohol. He also denies illicit drug use. Sounds like a pretty amazing 20-year-old.
I was gonna say his mom's sitting right there.
So what is our assessment? He's got an inflamed appendix, right? Because it's swelling up. God only put so much room in us. That's why it hurts. It's swollen. What causes the appendicitis? Something got stuck in that appendix. It could be a foreign body, God forbid, like a dime. I've had a little kid eat a dime, and for some reason the appendix said, I'll take it, instead of it going through the gut. It could be a stone, it could be a tumor. Something is compromising the blood flow to that little dude. And that's why he's getting inflamed.
What did you say hung off again?
Huh?
Hangs off
Off the cecum.
the cecum?
It's a little dude. Your appendix is no bigger than your little finger. What needs to be done immediately? Well, you better tell the doctor you got a positive McBurney. You tell him straight up, I got a positive McBurney. Yeah. Stool. Good question, fecalus. It's a piece of stool that's stuck in there. Good question. You need to call the doctor. You better start an IV right now. What's the rule about IVs? If you can get one, you get two. This boy's gonna go to surgery. Don't bother with this. Stick them in the AC, especially if you're in the ER. Okay? They can handle a bigger gauge. They're easier to start, just stick to it.
You said don't worry about what though?
The gauge.
Oh, okay.
I don't want a 22 here.
Oh, you said don't worry about that.
I want an 18 here.
In emergency settings.
Uh-huh. Anytime you have a potential for somebody to crash, that's why I tell you guys, if they're medically stable, they got pneumonia, but we're gonna treat it with antibiotics and it's not gonna be a big deal. Start them here. Or start them here. But if they're getting ready to crash and you're worried about it, how about you go into that AC? That's why I tell you guys, save the ACs for emergencies. Okay? Save the AC, the anticubital for emergencies. Why? Because it can take a big gauge needle, the garden hose, 18 gauges. Obtain blood work, you mentioned that, Sam?
Yes.
I want a CBC, I want a Chem 10, I want a rainbow on this boy. That means I want it all, because I'm greedy and it's all about me. Better get a urinalysis, make sure he doesn't already have an infection. Do you think I need to keep him NPO?
Yeah.
Yes, especially if he's already complaining of puking.
What would you find in the urine analysis?
I want to know if he's already got an infection in his kidneys. And I also want to know if his kidney function as well.
So would the nitrates pop up in it?
Or you're gonna just get the UA and you look at it. If it's cloudy and it stinks, chances are he's already got something. Do you think he needs some pain medicine?
Yes.
Yeah. He's 20-year-old curled up like a 5-year-old ballad. Please give him some pain medicine. How about an antibiotic? Yes. He needs a broad spectrum antibiotic preoperatively. A broad spectrum antibiotic preoperatively to protect him. Because if this little lala goes inside the body, he's going to go septic. And then you're going to be chasing it.
What's inside of it?
Huh?
What's inside of it?
Right now, I don't know. My X-ray vision doesn't work. But I do know if it's red and it's inflamed, that it's fighting an infection. Because the blood's not flowing correctly. And it's going to start chewing on itself.
And if it pops, what does it do?
Huh?
If it pops, what does
It's
it
going to
release?
spill its huh?
It's gonna
What
send
is
the
it
infection
releasing?
into your bloodstream. What is it releasing?
Toxins.
Toxins? Okay.
That's the good word. Toxins. So we're going to give antibiotics, analgesics, and antiemetic. Oh goodness, look at his white count. 15K. I don't like that, do I? No. Ultrasound confirmed, acute appendicitis. Bye-bye, you go to surgery now. They're gonna do a laparoscopic. That's where they make the little holes, and they fill you up with gas, and then they go in there and look around, and the tools, there's a light, there's a suction, there's a gas tube, there's a camera, and there's a little carver. And what they like to do is they'll go in, they'll tie off the appendix and then hack it off and then cut it up and suck it out.
I got my laser viewer. That's why I asked.
Do you think I need to get a consent before we do the surgery?
Yes.
Yes.
Would not need a surgery.
He still can sign it? What are the elements of a consent? What are the elements in a consent?
The nurses just.
Number one, they gotta be A&O times 4. Not stoned out of their mind on pain meds, right? Whoever's doing the procedure has to explain it. It's not your job.
We just
The surgeon, the MA, the PA, if it's something simple like, tapping somebody's lungs, a nurse practitioner, okay? Whoever's doing the procedure has to explain. Now catch this, you ready? The risks and benefits of doing the procedure. Yes? The risks and benefits of not doing the procedure. The alternatives to the procedure. And sometimes, if it's really big and invasive like this, they'll also include permission to give blood transfusion. Okay? Now, can I use abbreviations on a consent? No. So if it was me going in and getting my bypass done, the doctor cannot write cabbage times 4 vessels. It literally has to say coronary artery bypass graft times 4 vessels. Okay? What does your signature on the consent mean?
And witnessed it.
That's all you're doing. You're promising that that is Mr. Jones in that bed signing it. Okay? That's all it means. Now, can I, you know, I'm getting wheeled in for my cabbage. Can I change my mind just as they're reeling me in?
Yeah.
Absolutely.
Is the risk of the benefits of doing it and not doing it and what else?
And the alternatives. And oftentimes a blood transfusion. So, we gotta get the consent, we gotta watch his vitals, and we need to educate this 20-year-old. All right? He needs to know about